This is a simple test you can do at home to test your adrenal glands. So it's called Ragland's postural blood pressure test. Very easy to do. All you need is a blood pressure cuff. Dr. Ragland was a medical doctor who created this test. Now, we're looking for adrenal insufficiencies and hypofunction of the adrenals, where the adrenals are not working like they should. So when we look at this, the splanchnic veins supply blood to the organs. This is what we're testing. The adrenals give the tone to the splanchnic veins. And that's why this happens when we do this test and we can evaluate things. So I don't do it a lot in the office because I know by the symptoms when they have possible adrenal fatigue, and we do the adrenal test. So the Dutch test, adrenal Dutch test. So a few things I jotted down you could have if you have adrenal fatigue: weakness, dizziness, chronic fatigue, fuzzy thinking, afternoon headaches. Afternoon headaches are a sign of adrenal, as well as afternoon energy drops. And the other thing that can be a problem with afternoon energy drops is pancreas insufficiency. You need the nutrients for the pancreas, which is chromium. Now, every time I talk about a nutrient or a supplement, I'm never talking about synthetics. Never. Because synthetics actually rob your body of nutrition. I did a video back, you can look, I think I called it Why Most Supplements Are a Scam. Talked about studies that prove things negative about synthetic vitamins, things like ascorbic acid, D-alpha tocopherol, beta carotene. I remember a few of those studies off the top of my head. WISE had 3 studies, increased vitamin C, which is, you'll see as ascorbic acid in a synthetic, increased cancer. There's a Serbian Danish study I reported, A, C, and E increased digestive cancer. So C would be, again, ascorbic acid, E would be D-alpha tocopherol, so for instance, synthetic. Lancet Medical Journal, Dr. Pinn, he said, according to the studies, absolutely no value in synthetic E and beta carotene. So you don't want to use, whenever I'm talking about these, you don't run and get some synthetic supplement. You need supplements for foods. If food's your best medicine, the supplement to take is a food concentrate. So afternoon symptoms, yes, that can be afternoon crash, afternoon headaches, can be adrenal. Sleepiness, that's another one, adrenal, and that's you know in the afternoon when it crashes. Now, when you sleep good all night, wake up and you're tired and you don't really wake up, like feel good till 11 or 12, that's a probable thyroid problem. So we'll talk about that on another video. So when we take this test, we're going to take lay down on your back for a while, maybe 10 minutes, take your blood pressure, then stand up real quick, take it again. If that difference standing, it should be 4 to 10 millimeters higher than when you were laying. And if it's not, if it's say lower especially, that's a sign, according to Dr. Ragland, of adrenal insufficiency. So the adrenals aren't doing what they should. They need the proper nutrition. Now this is what it looks like, adrenal tests. So this is morning, and this is night. So when we take the adrenal test, now it's going to show us other things besides this graph and the adrenals and cortisol. We're measuring cortisol with this test, but we're also going to see metabolized cortisol, we see free cortisol, estradiol, which is estrogen, progesterone, testosterone, 5-alpha, androstenediol, and total DHEA, which DHEA comes from the adrenals, big player in the adrenals. So when we see this, this is a curve it should be, and we should see there should be 4 or 5 samples, and we should see it going right pretty much in here. And this is why you cannot take just one cortisol test through a day. Oh yeah, my cortisol is normal, because it fluctuates through the day. It should be low here. Now we might take this case, I just got one back, was low here, came up, but by nighttime was down. That's not normal. Sometimes they're way up here, sometimes they're out here, sometimes they're out here, down here, and up there. So that's why you can't take one cortisol test through the day. You have to take it, a number of tests, and see what that diurnal pattern is, and then you can say what you need to do with the patient. So if you want to do something at home just to test your adrenals, again, lay down, give it a few minutes, take the blood pressure, stand up. Did it go up 4 to 10 millimeters when you stood up? It should, and if it does, there's less chance you have adrenal problems. You still could, and if it if it doesn't, if it's lower, then you most likely have some adrenal insufficiency, and you need a proper nutrition for the adrenals.